This is our monthly hyperbaric medicine update with all the latest research. My students tell me that daily videos are boring, but a monthly digest would be better. Or less videos per month makes me more attractive. I don't really know. I'm happy to share the knowledge with you guys. But here we go as far as hyperbaric. The latest research for now shows us that if women have had breast cancer and they have a surgery and they have swelling of their arm, lymphedema, where the entire thing is swollen up with fluid, even up to 10 years later, hyperbaric oxygen therapy can get that swelling down. 30 sessions. Now, many people have this and it really bothers them, but when you tell them what these options are, they may not take you too seriously. But and there's only a case series of only 6 patients, but nonetheless, 6 people did improve with 30 sessions. So it's important for us to know this as practitioners. The next falls into the domain of brain injury, and people with brain injury will have autonomic storming or paroxysmal sympathetic hyperactivity. So here we have a study with 92 patients, and 56 get hyperbaric, 36 don't, and the ones who do get hyperbaric have less storming. So definitely it's a good thing. It's a problem we face when we treat these kind of patients on the acute side, just because of all the problems they have. But if you can stop the storming, they can wake up and they can show you what their potential is. The other way to track changes is a study that shows us EEG can look at microstate changes when a person is receiving hyperbaric oxygen therapy. So provided you do all these treatments and they show you the change in microstate, you know they're actually improving, even though their clinical status may not show you an immediate change right away. Next falls in the domain of bone. So people with refractory osteomyelitis, they really suffer. They end up getting so many antibiotics, their body becomes resistant, they can get other infections. Here's a study with 58 people that shows you those with chronic refractory osteomyelitis can improve with hyperbaric oxygen therapy, get the infection to go, reduce the need for antibiotics. I remember a story from probably like 12 or 14 years ago. This guy gets his foot caught in a generator, ankle fracture, some ortho does a surgery for him. It goes into a malunion, but it gets a bone infection, and it keeps on getting infected. So over the next year, he keeps getting infections over and over and over again. And he comes in to get a corrective surgery for whatever remains of his ankle. The next morning he wakes up and he's paraplegic. And why? All because he was so resistant to antibiotics, he got an epidural abscess. Now, did that happen before coming to us or in the ward? He was in the ward for less than 12 hours, so it's hard to say the blame is with the hospital. But resistance to antibiotics making these kind of things happen, heck yeah. And if you can take care of it with hyperbaric oxygen therapy, why make a patient suffer? Why make them wait? So along those lines, we have a hyperbaric study looking at knee osteoarthritis in rats. And it does show that it slows down the rate of progression of arthritis in the knee in rats. Now, is knee arthritis in rats deficiency of hyperbaric oxygen therapy? No, but it does relate to this reactive oxygen species, reactive nitrogen species, hormesis theory. So it's no surprise, but then is that the real treatment for a knee OA? If your person will not lose weight, if they won't go on standard treatments and they're willing to do this wild stuff, it might get them some degree of symptom control so they can do the normal stuff. Healthcare nowadays is more of a negotiation with people who don't have a good idea what they're actually getting into. So, fine. The last two things are, one is a Crohn's study. Now, we know from a lot of good meta-analyses, systematic reviews, that hyperbaric oxygen therapy helps in Crohn's. Here they have 61 people that also benefited. Great. You know, as we move towards fancier and fancier drugs and more expensive treatments that get pushed by pharmacy companies onto doctors, when people can't afford, it's very much an issue that the doctor doesn't know what to do anymore. But these are simple, cost-effective options that can reduce the need for all those things. And if you look in the literature, you'll see there's even studies that compare this to other things, the standard care, that makes them just better. Why not get your patients better? And the last is complex regional pain syndrome. It's a systematic review of 280 people with this, and they get better. So when you see this and you're not getting results with all the standard injections and medications, do consider hyperbaric oxygen therapy.